Should you take melatonin to help you sleep? Is that what you should be reaching for if you can't get a good night's sleep or you're not able to fall asleep or what have you? Guys, I'm actually going to give you that answer today. Make sure you watch to the end of this video. We're going to be talking about melatonin, the ins and outs of it. By the way, many of you are probably familiar with melatonin. It is a supplement that we often see on our drugstore shelves. Many people take it to help them get to sleep better, faster, etc. Is it right for you? Is it the right thing? I'm going to tell you all about it. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let's start with melatonin in the first place. Now, I don't know if you guys knew, but melatonin actually is a hormone that exists in our body. That's right. It's a hormone that's made in our body, and it actually helps regulate our sleep and wake cycles. That's like our circadian rhythms. And actually, this is the thing. Melatonin is the kind of thing that helps us go from day to night. Actually, when it gets darker, more melatonin is made in our body. Darkness kind of triggers melatonin to be made, which helps us go to sleep and get sleep. However, when there's light or, it's bright out, it triggers our body to make less melatonin. It decreases melatonin, which signals to our body, hey, let's get up. It's time to wake up. So just understand that is actually how melatonin works in our body. I think that's one of the reasons why a lot of people may feel comfortable taking this over the counter, is because many know that melatonin actually exists as a hormone in our body. All right, so melatonin comes in lots of different forms, right? We know it comes in the form of supplements, like pills, but I've also seen like melatonin gels, creams, and other stuff. We know that supplements sometimes come in different forms these days. Also, there are different dosages. There's a range of dosages, different ones for kids versus adults. Again, we're focusing on the adults, but also there tends to be shorter acting versus longer acting formulations as well. So keep that in mind. So this is the thing. Okay, before I talk about does it work, yes or no, and by the way, I have patients that do take melatonin. I have patients that I have said, yes, it's okay to take it. I had patients where I said, no, it's not okay to take it. Let me back up and give you some potential side effects of melatonin, right? And I always say this, regardless of whether it's a prescription medication or a supplement, etc., there are potential risks and benefits to everything. Melatonin is also in that category. So let's just quickly run through those, all right? First of all, we have to remember that as a supplement, it's not necessarily tightly regulated by the Food and Drug Administration. So that could leave variations and variabilities with brands and types and ingredients and things of that nature. You always have to keep that in mind when you're dealing with supplements, okay? The other thing is that just like many other supplements and medications, melatonin can also interact with other medications, interact with other supplements. And it also may sort of make it more difficult for you to be on certain medications, etc. I would also say there are certain people with certain underlying conditions that should not take melatonin, right? So it's not right for everyone. Also, we generally think of melatonin as being something used for the short term. This is not something I've ever recommended for the long term. Most physicians that I know do not. It's generally something we think about if you are using it for the short term, and it can have side effects, as most things can. Headache, dizziness, sleepiness, and nausea can be some side effects of melatonin use. Also, you shouldn't really operate heavy machinery, et cetera, within so many hours of taking the medication for obvious reasons, right? You could be drowsy, etc. So let's get to brass tacks, and I've sort of given you a 50,000-foot overview of the medication. Should you take it? Does it work? What's the deal with it? Well, let's start with, does it work? The answer is yes and no. I've had patients, in my personal experience as a physician, I've had patients that say, yes, it has worked for me. Other patients say, no, it really didn't work for me. I think the experience that one may have with melatonin is probably variable. It varies depending on the person. It also varies depending on the dose you take, as well as the brand, etc. Okay, remember there are variabilities even with brands, etc. So there's a yes and a no to that. The other thing to keep in mind is, from a medical standpoint, different guidelines say different things. So while many medical associations say, yeah, it's okay to try melatonin for the short term, blah, 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 for these conditions, there are some that say, no, we don't recommend trying melatonin. So please keep that in mind. Remember that melatonin, if you choose to take it, the hope is that it decreases the time that you need to get to sleep, okay? That's one of the hopes. And yes, it does that for some people, but again, it doesn't for others. What I would say is this, look, if you're interested in trying melatonin for sleep for the short term, you do really need to talk to your doctor first to make sure you're one of these people that should take it, that it's okay to take it with, based on the other medications you're on, the other medical history and conditions that you have, etc. That's going to be really important. And I think that the other thing to keep in mind is that, as a physician, a lot of my patients want natural things, and I'm all for that. My first choice when it comes to not being able to sleep is things like sleep hygiene and behavioral modifications and things we can do to enhance our sleep. I've done videos on that, ways to make your home, your bedroom, yourself more conducive to sleep. Check out some of those other videos on the best ways to get sleep. I'll put those actually in the description of this video. But, those behavioral modifications and things like that should, in my opinion, always be first line. But this is the thing. Does it work? Well, it does for some. It may not for others. What you need to do is you got to talk to your doctor to see if it's right for you to try. I hope this was helpful. Let me know in the comments. Do you take melatonin? Have you taken melatonin? Has it worked for you? Does it work for you? Et cetera, et cetera. Let me know. Guys, I'm Dr. Jen. As always, it's good to see you. You are my favorite people, besides my patients, I should say. Hi, patients. If you've not subscribed to my channel or clicked the little bell for updates, please do. Also, please consider joining my subscription groups for exclusive content as well. Guys, I'm Dr. Jen. I'll see you soon.